Welcome everyone, thank you for coming. I'm going to read a quote from Amy Parker. She is a 37-year-old woman who grew up in a crunchy granola, very healthy home, and her mother chose to not vaccinate her and her other siblings. And this is a quote from her. She says, "I struggle to understand why I know far more people who have experienced complications from preventable childhood illnesses than I have ever met with complications from vaccinations." Amy goes on to explain that she has suffered from measles, mumps, rubella, viral meningitis, pertussis, and chickenpox, all which can be prevented by vaccinations. She explains that she did vaccinate her children and is really happy about that choice because they did not contract any of these diseases and have spent minimal time in hospitals, which she spent a lot of the majority of her childhood in hospitals. So vaccinating your children is the only way to protect them and other children from life-threatening or potentially life-threatening and preventable illnesses. Without vaccines, diseases like measles, mumps, rubella, polio, pneumonia, meningitis, influenza, and pertussis can spread, causing epidemics, and the death toll will rise. Most of the information I gathered for my speech came from the CDC, the Centers of Disease Control. The Centers of Disease Control works 24/7 to prevent the spread of disease and illness, and they really support communities and citizens who do the same. A few stats from the CDC about illnesses prior to vaccinations. Back in 1921, diphtheria was rampant, and 15,000 people died a year from diphtheria. And since we've been vaccinating, there has been one case of diphtheria since 2004. Another case is rubella. Back in 1965, there was an epidemic of rubella where 12.5 million people were infected. 2,000 babies lost their lives, and 11,000 women ended up miscarrying because of rubella. And now statistics show that since 2012, there have only been 9 cases of rubella in the United States. That's a huge difference, and all because we've been vaccinating. The issue is that not vaccinating healthy children lowers the herd immunity. And I'll explain herd immunity in a minute, but before I do so, I need to explain that there is a population of people that cannot be vaccinated. There are children who are immunocompromised, who may have cancer, and they are unable to get vaccinations. There are children who are too young to receive vaccinations. There are children or people who are allergic to a compound in the vaccination, like eggs, and therefore they're not able to receive it. And then there's another subgroup that they received the vaccination, but it wasn't effective inside their body, or their body didn't react to it to build the immunity like it was supposed to. So this group of people aren't able to be immunized against diseases, and therefore herd immunity is very important. Herd immunity is the indirect protection of that subgroup of people through everyone else being vaccinated. So by me being vaccinated, I can't spread the disease to someone who isn't vaccinated due to being immunocompromised or too young to receive the vaccine. But if I, even though I'm a healthy individual, don't get vaccinated and I end up getting the measles, I can transfer it to anyone and unfortunately transfer it to the baby to get the vaccination. It's really a wonder why people do not vaccinate, since vaccinations are very cheap. I think with Obamacare, as far as I know, the co-pays are free to get vaccinations. So there really is nothing preventing people from vaccinating except fear. A couple things that people are afraid of. There are a few reasons why people don't vaccinate because of fear. One is that vaccinations can be life-threatening. This is true. About 1 in 1 million children has an anaphylactic reaction to a vaccination. Now, that is such a small amount. It's so very rare. And all of the major health organizations really speak up to the effectiveness and the low risk that vaccinations have. But I do understand that having that one child, 1 in 1 million child, can be very scary. But the risks really outweigh the benefits. Another reason why people are afraid is because they think there are harmful chemicals or harmful substances in vaccinations, one of them being mercury or aluminum. And the levels of those substances are so low in the vaccination that they would not do harm to anyone, no matter what age the child is. I also read that there are higher levels of aluminum in breast milk than they are in the vaccinations. So that myth is not correct. Another reason why people choose not to vaccinate is that they feel like the diseases aren't prevalent in our area, which is true. Measles, mumps, rubella, we don't really have those diseases floating around as much as we used to. But that is because of vaccinations. And as soon as we stop vaccinating, those illnesses and diseases will take over and cause epidemics. We saw in 2013 a case very similar. There were communities in New York City that had low rates, and a case of measles spread through the town and caused a lot of people to become very sick and caused an epidemic within the town. So it's very important to protect those who aren't able to be vaccinated by getting vaccinations if you're healthy. An argument against the fact that diseases aren't prevalent is that diseases are prevalent in other parts of the world, like Africa and Europe. We may not have the diseases here, but they are prevalent there, and we have people vacationing there and bringing it home with them, or immigrants coming into this country to live and bringing the illness or disease with them. I want to explain a little story about a little girl with ALL. She was 2 years old and she had acute lymphocytic leukemia. She was vacationing down in Disneyland with her family and on a break from her chemo treatments, and she ended up coming in contact with a little boy who didn't have any vaccinations, and he had contracted measles. Well, she ended up getting measles and passing away because her body wasn't strong enough to fight off the infection. Now, that's just a devastating story because it was so preventable. Her life could have been saved if he was vaccinated. He was a strong, healthy little boy, and it's just really devastating. The measles didn't really affect him too much. It's a pretty minimal illness for a healthy individual, but her body wasn't able to fight it off. Vaccinations really are the best way to protect all kids against potentially life-threatening illnesses. Without vaccinations, diseases will spread. Vaccinations are 99% effective, so it's silly not to use them. And over 730,000 children's lives are saved every year through the use of vaccinations. I'm going to list a few health organizations that are well known that all support vaccinations. The FDA, Food and Drug Administration, the CDC, Centers of Disease Control, the Institute of Medicine, the Academy of American Pediatrics, the American Medical Association, the Department of Health and Human Services, and the World Health Organization all condone the use of vaccinations. And the Department of Health and Human Services state that vaccinations are probably the most safe medical product available. So that's huge. I wanted to finish up by saying that Jeff Kluger put it best. He is an advocate for vaccinations, and he says that vaccines save lives, but fear endangers them. And that's so true. Fear and unknowing is what potentially is devastating by not getting the vaccinations. The future with all able children vaccinated is healthier. All diseases could be eradicated like smallpox has been through the use of vaccinations. Compromised kids would be able to go to public school, would be able to go to birthday parties and hang out with their friends instead of living a life of solidarity because they're afraid of contracting little diseases. And to bring the point back home that it could save over 730,000 children every year. So thank you. I hope you think twice about vaccinating your children.